Hey guys, it's been a while since I have talked about nursing, so today I thought I would sit down and let you guys know what I do as a primary care nurse. So I am the only nurse working for my doctor. We are hiring a physician assistant in February, so I will also be working with her throughout the week. This is also the first nursing job where I am also the phlebotomist, so I have to know order of draw, what test goes in what tube. I have to know what specimens need to be frozen. I have to make sure specimens are labeled. And I also have to print the order that my doctor puts in for the testing. I have to print them out, put them in the specimen bag. And at the end of the day, after all patients are done and taken care of, I have to make sure I put that in the lab box outside of our office so that the lab carrier picks them up, takes them to the hospital, and gets the test done. Once the tests are done, my doctor will review them, and if anything's abnormal, he'll send it to my inbox. That goes for mammograms, DEXAs, MRIs, CT, pulmonary function test, lab results as well. And I will call the patient and let them know what's going on. If they have to be placed on medication because of diabetes or their thyroid or vitamin D or B12, I call them and let them know that as well. And basically, I go to the waiting room, I'll call them back, I get their weight, I will take them back to the room, and if it's just a follow-up appointment, I will update their drug allergies, medications, surgeries, address any other concerns they have while they're there for their follow-up. Once I'm done with that, I get their vitals, walk out of the room, let my doctor know what's going on, and then he goes in and does his thing. If they're brand new patients to us, I have a medical release form that they can sign so that we can get their records from a previous primary care or any other specialty office that they have seen before us. That way we are still continuing treatment for things that they've already had in the past. But same thing, I'll call the new patient back, get their weight, take them in the room. I tend to build their chart after I leave the room. While I'm in there, I will verify medication and drug allergies and any concerns. Most of the time, I just make a copy of the new patient paperwork and keep it on my desk. That way, while he's in the room talking to them about how he's going to treat them and take care of them, I'm building their chart and putting in all of their social history, family history, things like that. Because he likes to have that copy and go in the room with it and scribble on it. So while he's doing all of that, I'm building their chart. That way we stay on time and we don't get too far behind, because new patients are supposed to show up 30 minutes prior to their actual appointment time. And sometimes they show up right at their appointment time, or we do have a 15-minute grace period and they will show up past that 15-minute grace period. So I just make a copy of the paperwork to try and stay on track as much as possible, because that can be time consuming if I'm in the room listening to them and their concerns and everything they're talking about while building their chart. I feel like that's less time they're going to have with the doctor, so I'd rather them have more time with him and let me do all that work outside the room. I'm responsible for giving vaccines like the flu shot, Prevnar 13, Pneumo 23, tetanus. I do the tuberculosis testing for the Manitox testing. That's really rare though. I think I've been there like a year and I've only done that like 2 or 3 times. I thought it would be more common because so many people work in healthcare, but apparently not. Or at least the people that come to us. I do run EKGs. We do pap smears. And since I am the phlebotomist, I do labs. He'll come up to me after he sees the patient and he'll say, hey, I need you to draw a CBC, CMP, A1C, FLP, vitamin D, and most of the time we do a urine microalbumin on the patients if they're new to us, just to make sure they don't have any underlying kidney conditions or disorders. And yeah, in between patients, I'm calling other patients with their lab results. I also know how to cancel appointments, schedule appointments. I schedule new patients and send out their new patient packets. I know how to take co-pays. I'm also responsible for letting my manager know what supplies we need. So anytime we need table paper, gloves, gauze, band-aids, suture removal kits, peroxide, alcohol, syringes, needles, all that good stuff. I have to let her know. I keep a list. I'm also responsible for letting the lab management know what supplies I need, like if I need tourniquets, butterflies, tubes, Vacutainer holders, pipettes, specimen bags, all that good stuff. I have to let them know that I need those. So usually once or twice a month, I have a list that I give to my manager to order those. The lab manager, I can just text or call her and let her know what I need. And I usually have my supplies within the day or next day. So I always wait till I'm almost out. That way I'm not constantly harassing her for stuff I need. So yeah, we see a lot of patients with hypertension, diabetes. We have heart failure patients who go to a heart failure clinic. I do basic wound care, nothing too extensive. Most patients who have drains or any type of wound that needs to be cared for either have home health nurses coming out to assess the wound, or they go to the wound care clinic. What else do I do? I just do so much. I don't even know what to say. I print off orders from my doctor for home health orders or, prescription renewals if they don't come through electronically. And any paperwork that a patient drops off or that gets faxed through, I try to fill out as much of it that I can. That way he can just review it and sign off on it, so it's less work for him, because he's constantly putting in orders, constantly reviewing lab results and charting and writing all these things, and I don't want to take away from that. So I always try to make it easier for him. I really thought working as the only nurse would be nerve-wracking and scary, but I love being the only nurse, and I love having to draw blood, because that's just another skill that I can add to my resume if I needed to. I don't plan on going anywhere because I love where I'm at. It's such a family-oriented facility, and the morale with the whole company is just so much better. But yeah, so we see bariatric patients that have had gastric sleeve surgery, and we just make sure that they're on the right track. Some of them like to see a therapist, and we also refer them to a dietitian if they don't have one or they stop seeing one and they want to see someone else. But yeah, my main goal is to make sure that my patients are taken care of, and I want to address any concerns that they have when they come into the office. We typically see 15 to 18 patients a day, depending if I double book. Anytime there's a new patient slot, say a patient calls and all of our acute care slots are taken up, sometimes I double book because new patients don't always show up. And when they do, sometimes they don't have their paperwork filled out. So while he's seeing the other patient that's there for sinus infection or back pain or a wound, or high blood pressure, while he's seeing them and they're filling out paperwork, it kind of works out, because as soon as they're done with the paperwork, I can actually bring them back and then they get their turn. So I always try to keep it running smooth, and I try to see the patients. I try to fit them in if I can, especially if I feel like they really need to be seen. And the most important thing to me, aside from staying on time and staying on track, is building a relationship with my patient to let them know I'm here to care for you. I'm not here to just be like, oh, you're here to see the doctor, let me get your vitals and walk out. I want to know your concerns. I want to know how your medication's treating your condition. I want to know if your blood pressure is being managed and monitored. If we put you on metoprolol and hydrochlorothiazide, but your blood pressure is still 200 over 150, we have a problem. We need to get that under control. And there are certain patients who can't afford a blood pressure monitor cuff or a blood glucose monitor. So I reach out to certain places around the area that partner with us, or I find programs like assistance programs where patients can get medicine for free or for low cost. And I try to get them the resources and medications that they need, because I know they need it. And I want them to be taken care of. And I want that relationship with my patient that they know they can talk to me about any concern, And I want them to know that it's actually being heard. It's not just them saying it and it's going in my ear and right out the other. I want them to be taken care of. That's why I became a nurse. So yeah, just multitasking. I'm answering phones. I'm calling patients in between other patients with lab results. If he comes up to me and says, hey, I need you to draw a BMP, CMP, troponin, CPK, and do an EKG on this patient in room 4, I'm just like, oh my gosh. So I'll go down there, do all that, come back out, put another patient in the other room, and I'm just constantly moving. I'm constantly doing things. And I think the best thing about primary care is we see a little bit of everything, and every day I'm learning something new, whether like one of my patients was the first patient I've had with the Freestyle Libre for blood glucose, and he showed me how it works and what he does, how to check his glucose, and when he showed me, I was like, that is so cool. So some of our patients are the first that I've seen with new technology and new medications and devices that are coming out, and it's just so cool. I really am glad that I chose nursing, and I think, going back in my old videos, if you watch those, you'll see how excited I am, and I'm definitely a hands-on person, so when they come in with these new devices, I'm always like, oh, well, can I try it? Like, let me swipe this over and check your blood sugar for you, and of course the patient didn't care. He was really cool. So it's just really cool to see a patient go from what they come into us as with their ailments, uncontrolled blood glucose, uncontrolled blood pressure, and then when they do a 180 and we finally help get that under control and they're doing 10 times better and they're like a whole new person, or they come in a wheelchair because, they're leg pain or they have edema, cellulitis, and then we finally get those things taken care of and they come in with a walker or a cane or they're just walking down the hall. It's like, oh, this stress is worth it. Not every day is a great day. If someone tells you that every day is great, they're a liar. There are days that I'm so stressed that I want to cry or pull my hair out, but more days than not, it's a great day. I get to see my patients making better choices and taking care of themselves and losing weight and getting diabetes under control, and it's just so motivating. And that's why I'm trying to get my life under control and be healthier, because I want to be a good role model for them, because they motivate me. When I see them, their A1C dropping from 11.6 to 8.3 to 5.4, it's like, wow, you were on insulin and then orals and then now you're on nothing and we're just going to keep monitoring it. Like, it's just so great. It's a great feeling. So that's really all I can think of that I do at work. If you guys have any questions or comments, please feel free to leave them. And if I think of anything else that I can make nursing related, I'll make a video about it. But other than that, that's pretty much what I do on a daily basis. I'm just constantly running around, making sure that everything is being taken care of. And I will see you guys in my next video.